This video is aimed at staff caring for children and young people with medical needs in the school setting. It will demonstrate how to put on personal protective equipment and how to take it off safely. There are two types of personal protective equipment that need to be worn according to the intervention. Please be aware there are procedures which increase the risk of coronavirus transmission through aerosols or tiny droplets being transferred from the child to the caregiver. These are known as aerosol generating procedures. Aerosol generating procedures include tracheostomy insertion or removal, non-invasive ventilation, including CPAP and BiPAP, high-flow nasal oxygen, and respiratory tract suctioning, including suctioning of the mouth, the nose, and via the tracheostomy tube. If you are carrying out a procedure that is not aerosol generating, but you cannot maintain a 2-meter distance, such as enteral feeding, please refer to the personal protective equipment required in the latter part of this video. Before you carry out an aerosol generating procedure, ensure you have received fit test training. Before you carry out an aerosol generating procedure, the child or young person should be taken from the classroom or shared area for care to be carried out in a designated room with the doors closed and any windows open. If this is not possible, for example, in children and young people who require sporadic care, such as urgent tracheostomy tube suction, individual risk assessments should be carried out. This is the personal protective equipment required for an aerosol generating procedure. You will need non-sterile gloves, a long-sleeved fluid-resistant disposable gown, an FFP2 or 3 respirator mask, eye protection, either a face shield or goggles, and alcohol gel. Wash your hands according to the Public Health England Best Practice Hand Washing Guide. Dry hands thoroughly and use the hand towel or your elbow to turn off the tap. Put on the long-sleeved fluid-resistant disposable gown. Fasten the waist and the neckties. Put on the respirator mask. Put on the face shield. Apply gloves, ensuring the cuff of the gown is covered by the cuff of the glove. You are now ready to carry out the procedure. Personal protective equipment can be disposed of in a domestic waste bag as long as the child or young person has no symptoms of coronavirus. Remove gloves by peeling off one inside the other and dispose. Clean hands with alcohol gel according to the Public Health England Alcohol Hand Rub Guide. Unfasten neck and waist ties. Pull gown away from the neck and shoulders, turn inside out, roll into a bundle and discard. Remove the face shield. Lift straps over the head and let the mask fall away from the face and then dispose. Wash your hands with soap and water. This is the standard personal protective equipment required for a non-aerosol generating procedure. Gloves, a plastic apron, a fluid-resistant surgical face mask, and alcohol hand gel. Wash your hands according to the Public Health England Best Practice Hand Washing Guide. Dry your hands thoroughly and use the paper towel or your elbow to turn the tap off. Put on the apron and tie it at the waist. Put on the face mask and mould the metal strap at the bridge of your nose. Put on the gloves. You are now ready to carry out the procedure. Once finished, dispose of personal protective equipment in a domestic waste bin in the following order. Remove gloves by peeling off one inside the other and dispose. Clean hands with alcohol gel according to the Public Health England Best Practice Alcohol Hand Rub Guide. Unfasten or break apron ties and let the apron fold down and in on itself, then discard. Remove the face mask once the task is complete. Remove by handling the ties only. Discard and do not reuse once removed. Wash your hands with soap and water.